Welcome to the first video for Chapter 9 on joints. So the first thing we have to do is define what a joint is. So a joint is another word for an articulation. And this is a place where two or more bones come together. Now sometimes they meet up and they fuse together, or there are very strong ligaments that hold them together so they do not move. And sometimes there might be a disc of cartilage in between them, but any place where two or more bones come together can be considered a joint. The structure is directly correlated to the degree of movement. So this is how they categorize different joints. So the types of joints that we're going to see, the first one is called a fibrous joint. The second, cartilaginous. And the third, synovial. So as we go down, we have increased movement. So fibrous joints, there's little to no movement. Synovial, we have a lot of movement. And based on how the bones are connected together or come in contact with another, tells us what type of joint it is. When we look at joints in a medical terminology aspect, the prefix that relates to joints is arthra. So we see this in a very common term, arthritis. Itis is an inflammation, so arthritis would be an inflammation of a joint. You could get a specialized degree in arthrology, which would be studying of the joints. So, arthrologist would be a person who studies joints. So this prefix refers to a joint. So let's start looking at these different types of joints. So the first one we're going to look at is a fibrous joint. So this is two bones united by fibrous connective tissue. So there's no joint cavity, and a joint cavity is just a space between the bones, often filled with fluid or a large piece of cartilage. So there's very little space, so the connective tissue is very, very short. There is little to no movement of the bones. So this type of joint is pretty much a solid joint. And there's actually three different types of fibrous joints. The first, and we've seen the first one, and those are sutures. So these were the skull bones, and we have dense, regular connective tissue that links these together. They have interlocking finger-like projections, which we talked a little bit about when we talked about the skull bones, that increases stability and contact. So it increases the surface area. So if it were just straight, so my fingers would be the joining of the two bones, it could slide past one another. So something could rip that apart easily. But if they interlock like this, it's a lot harder to separate those. So they're like finger-like projections. And these are not closed in infants. And we get something called a fontanelle or soft spot. And I will put up a couple pictures of what these soft spots look like. They are a weak area in a baby's head. So the reason that they are there is because during the process of birth, the baby's head is one of the more difficult things to pass through the birth canal. So the bones aren't fully locked in place, so they can actually slide a little bit and compact in order for the baby's head to be delivered. And it's not unusual after a baby's born that their head is a little bit misshapen, but it's perfectly fine. It will actually go back down. But you have to be careful of a baby's soft spot, especially if they're born premature. It can be a lot larger, but it will eventually close up. The most common soft spot is between the frontal and the parietals, right at the top. And that is usually where the pictures are. And sometimes you can actually see the arteries pulsing underneath there, underneath the thin layer of skin and connective tissue that is there.